Hi, my name is Diamond. Me, Kevin, Jerry, and Meta, we're doing a presentation on my best friend Zoe. It's about a girl named Meta. Okay, the character introduction. So the movie we did was my dad friend Zoe, and it was based on merit, and it talks about trauma, grief, and the loss of her friend while she was in a war, and it just talks about how she is going through the grief of her losing her friend. The background is Mart is a U.S. Army veteran who served in Afghanistan, where she lost her closest friend in combat, Zoe. She now feels isolated, and she's struggling with family and community in the community and returning home. Her daily experiences reflect a push pull between denial and painful reminders of her service. Um, Zoe Zoe is her deceased best friend who imaginally present symbols, and it talks about resolve. Yeah, resolve trauma. Her relationship with her grandmother and different people with her trauma. The V8 support network throughout resistance at first, and group therapy revolves her international conflict and show slow movements towards healing. So she's trying to heal.
Thank you, Diamond. I appreciate it very much.
Okay.
Okay, so the diagnosis that we came up with for Merritt, mainly that's kind of displayed in the movie, is PTSD, also known as post-traumatic stress disorder. We thought this was a good diagnosis for her, given the state that she's in, given her army combat, the things that happened, the nature of that situation, and then also how she's constantly seeing her friend throughout the movie, although she's not there, and then some of the different triggers within her brain, within her mind, as she's navigating life. So some further behaviors and a little bit more narrative role. Again, as I said before, I talked about the hallucinations and the illusion of her deceased friend, Zoe. She's constantly appearing to Merritt, though she's not actually there. And so we see some disassociation here a lot, even some functional impairment, given Merritt's military experience and interpersonal relationships, one specifically with her grandfather and some of the veterans in the community group. Those peers, we see a lot of things take place in her daily life that kind of disrupt her struggle, that allow her to, in a sense, get a break at times. And then again, she deals with a lot of avoidance throughout the hallucinations, and then juggling the relationships that she still have with certain peers. So as it relates to the DSM-5-TR, trauma and stress related disorder, there's a lot to consider here. As you can see, we've kind of broken it down to a couple of different things that we felt like was that went along with the primary diagnosis. The first one being exposure. Again, Merritt is obviously experiencing a lot of traumatic events, even way after her Army combat time. The second is some of those symptoms, intrusion symptoms, just the memories and the flashbacks that are being manifested about her best friend Zoe, and then avoidance, as I said before. Again, just avoiding reality, not wanting to face certain struggles head on, kind of isolating herself, and not allowing herself to be present in time and work through some of those things. And then a lot of the supporting evidence that we had to draw from this was just, again, putting the focus on the recurring interactions that she's having with Zoe that are not necessarily real, and then that's the emotional withdrawal. So, as I said before, there is a lot of things that went into this primary diagnosis. Reactivity is one of the things that we also wanted to touch on here that we thought Merritt was kind of exhibiting, along with the hypervigilance and the sleep disruption, just being constantly irritable and avoidance, as said before. Duration impairment and exclusion. These symptoms for us, they appear to be present for months on end. As we know, that timetable is very important. It plays a very important role when we're talking about diagnosis in general, as it relates to the DSM. Something that we also wanted to shine light on was the complexity of the diagnosis. The hallucinations were real and they were happening often throughout the entire film.
Thank you very much, Jerry. So our primary diagnosis is post-traumatic stress disorder. Merritt's combat exposure in Afghanistan and the death of her close friend Zoe met the criteria: exposure to actual or threatened death or serious injury. Her repeated visual experiences of Zoe function as intrusive symptoms consistent with criterion B. Merritt demonstrates avoidance behaviors. She knows negative alterations in cognition and mood. Behavioral patterns such as irritability, hypervigilance, and difficulty relaxing are consistent with the criteria. Symptoms appear persistent, impairing, and long-term, meaning criteria F and H. And the reason why it was PTSD and it fits best was Merritt's presentation included all 4 symptoms clusters required for PTSD. So the 2 other diagnoses that we ruled out was prolonged grief disorder, and that was because persistent preoccupation with Zoe's death may resemble PGD, and it was ruled out because PGD focuses on grief-specific symptoms, yearning, longing, preoccupation. Merritt's symptoms extend far beyond grief and included intrusive trauma, memories, avoidance patterns, and arousal disturbances not explained by PGD. PTSD provided a more fitting framework due to the trauma-linked nature of her symptoms. The second one we ruled out was adjustment disorder with anxiety and depressed mood, and the rationale for consideration was that Merritt struggles to adapt to civilian life and interpersonal stressors. The reason why it was ruled out was because the adjustment disorder symptoms must occur within 3 months of a stressor and resolve within 6 months once the stressor ends. Merritt's symptoms were much severe, and she meets the full PTSD criteria, which rules out adjustment disorder.
Okay. So for the biosocial cultural assessment, the biological factors that we chose was Merritt's genetic vulnerability to anxiety, depression, or trauma-related conditions, trauma exposure, the early loss of her father. Merritt lost her father at a young age to cancer, and her later exposure to drama or military trauma while she was in Afghanistan may have heightened her biological stress response. Some somatic stress reactions stemming from her unresolved grief of her friend Zoe may have led to her long-term avoidance of her grandfather due to her not being there for her grandfather whenever her grandmother passed away. And all of these reactions could have contributed to her emotional exhaustion and reduced cognitive focus. And her psychological factors is her unresolved childhood grief from losing her father at a young age with little modeled emotional behavior. Even her grandfather, who was a Army vet, he didn't necessarily show his grief. And then internalized emotional suppression. Merritt, she never learned how to express her emotions just from watching the interactions with her mother and her grandfather during the movie. And we just felt like the family had a pattern of silence. We feel like Merritt had complex grief and guilt related to Zoe because Merritt had strongly discouraged Zoe from re-enlisting in the Army, and we kind of felt like Zoe's family connection was her fellow Army members, and she lost that whenever she did not re-enlist. She feels she abandoned Zoe because once Zoe and Merritt got out of the Army, Merritt clearly adjusted better to civilian life than Zoe did, and she had missed several calls from Zoe before she committed suicide as Zoe was deteriorating. And Zoe's suicide intensifies Merritt's self-blame and trauma and heightened distress after a workplace incident. There was an incident at Merritt's job after Zoe's death that the court labeled as negligent, and she was ordered to the VA trauma group as a response. Merritt's family dynamics was, early loss of her father. Merritt's mother seemed a little distant, and she was obviously physically distant because she was working overseas in China, and it left her without immediate support. And then there was caretaker burden because Merritt becomes the primary caregiver of her grandfather, who was diagnosed with early stage Alzheimer's. Her grandfather was suffering in silence from the loss of his wife. And as a veteran mourning his wife's death, he models emotional stoicism rather than open communication, reinforces Merritt's belief that feelings should be hidden. And again, she had a lack of emotional modeling. And her social environment, veterans' identity and obligations, caring for her grandfather and navigating her own veteran status reinforces pressure to remain strong and unemotional. Merritt had been building a healthier social circle once she got out the military, and after Zoe's death, all of that went away due to her increased guilt, and she isolated herself after Zoe's death. So the cultural factors is military culture. They value stoicism, resilience, and emotional control, making it difficult for Merritt to acknowledge grief, guilt, and trauma. There was intergenerational military expectations. Both her grandfather's service and Zoe's resilience on the Army shaped Merritt's belief that duty must come before emotional needs. And then there were gender expectations. As a female veteran, Merritt could have felt pressure to prove her capabilities and independence. And the societal and structural pressures, the stigma around mental health in the military community as well as the veteran community makes seeking help feel like a failure. And then there's also the hero and survivor narratives, which leaves little room for trauma and guilt and survivor's remorse. Inadequate support systems for veterans and caregivers increase Merritt's sense of being overwhelmed and alone. And there was court-ordered therapy, which highlights the gap between societal expectations of stability and Merritt's internal crisis. The ethical considerations when working with clients like Merritt is balancing autonomy and safety. The major ethical challenge is respecting Merritt's autonomy while also addressing potential risk factors such as unresolved trauma, survivor's guilt, and emotional avoidance. Handling complex trauma and guilt, the clinicians must be careful not to impose interpretations or push Merritt to disclose before she is ready. And the risk of re-traumatization or overwhelming emotional flooding is significant. Because Merritt has a military background and caregiver obligations, the clinician must avoid assuming cultural familiarity and instead explore her experience without reinforcing stereotypes. And the clinician must also acknowledge military culture's emphasis on stoicism and self-reliance, creating a therapeutic space where emotional expression feels safe, which we felt like the group facilitator did do in this movie. And how should a professional handle this? A clinician would apply trauma-informed, client-centered care that prioritizes the safety, trust, and appropriate pacing. This approach aligns with the NASW Code of Ethics, which emphasizes the importance of service, dignity, and worth of the person, and the practitioner's responsibility to promote well-being through competent ethical practice. Research also indicates that trauma and moral injury can profoundly affect the brain's networks. The clinician should conduct continuous risk assessments while empowering Merritt to participate actively in treatment, and maintain clear professional boundaries and clarifying the therapeutic roles, and practicing cultural humility is critical, acknowledging that Merritt's emotional avoidance and suppression are learned survival strategies, and it was shaped by her family dynamics and military culture. Consistent with the NASW's commitment to culture competence and social diversity, the clinician should collaborate with Merritt to develop a gradual, personalized treatment plan that respects her readiness and supports her emotional expression. Thanks. And these are our references.